is pushing it down too. Bon appetit. My guest agrees. Waxman's quacked, and our goose really is cooked. And Missouri Republican Congressman Roy Blunt says it ain't right, that if it is not good enough for Congress, then this vaunted health care program is not good enough for him and should not be good enough for you. Very good to have you, Congressman. What do you make of this?
Well, Neil, I had actually 2 amendments in the committee that were right on target, though I'm not sure. I'm trying to get some of the goose analogies, and I can't quite get them to work, so I'll just tell you what we did. Last night, I tried to offer an amendment where every elected federal official, that would be the members of the House, the members of the Senate, the President and Vice President, would have to take the public plan. Because everybody here knows that if you have the public plan within a very short period of time, you're only going to have one plan. They all know that. We know that. We know the government's not going to be a fair competitor. And they'd like to paint us as the defenders of the status quo, which we're not at all. We want more choices, not fewer choices. But the chairman wouldn't let us vote on that amendment in our committee, even though 3 or 4 other committees had figured out how to take a vote on that amendment. And again, that amendment was every federally elected official would have to take the public plan if there was one. And then today they narrowly defeated another amendment of mine, which would have made the federal employees benefit plan available to everybody in the country that didn't have a plan that they could participate in. So that goes right back to Senator Barack Obama's statement he made over and over again during the campaign. Every American should have access to a plan like his, he said. He didn't point out about 3 things about his plan. One was every federal employee had access to the same choice of plans. 2 was they did get to choose and they did get to pay, depending on whether you wanted the most expensive or the least expensive or somewhere in the middle. And 3, he didn't point out that the one thing federal employees don't have access to is a government-run plan.
Well, but
if anybody knows
if
anybody knows they don't want a government-run plan, it's a bunch of government employees.
But you know, Congress, I really
ahead.
tried to give the benefit of the doubt on this decision and this move and rejecting your amendments, all that. But the one on just not going along or forcibly going along with the public plan, here was where I tried to give the benefit, and it was a stretch, but I was drinking a lot on yesterday's show, and it was a hangover. So one was, all right, this is the type of freedom we want to allow you. If you like the plan you're in, you stay in the plan you're in. If you don't, you can move. And that they were exercising that freedom, and that's the beauty of whatever they're cooking up. What do you think?
Well, you know, interestingly, the chairman said, you know, I'd vote for this if we could figure out how to make it available in our committee, but we just can't quite figure it out. So I'm not sure what message the chairman was trying to send. The message I was trying to send is, in the very near future, everybody would only have one plan, and that would be the public plan. So we might as well get in there at the start and try it out. Remember that ABC episode that I'm not sure if you could call it a news program, but it was something that the president was asked, if there was a government plan, would you pledge that your family would be on the government plan? And he said something like, very truthfully, no, I'd want my family to have the best possible health care available. Nobody thinks that if you have a government provider that that's going to be as good as having more choices and access for everybody, regardless of any pre-existing
what the president said,
today.
I caught that interview, Congressman. What the president said at the time is that this is a mistaken notion that what ultimately will be provided will not give you choices, and that folks like you are injecting fear out there that this is somehow going to be sort of like a Soviet cabal. I know you've countered that by saying we're not trying to put fear in anyone's heads here. We're just trying to tell you what we think this is going to do. But truth be known, Congressman, we don't know yet, right? I mean, the way this is going, what are we going to get? What do you think we're going to get? The one
thing we do know is I'm not sure we get anything, and you could have gotten a lot. This is an area where many members of Congress, and I'm particularly in that group, wanted more choices, wanted more coverage, wanted more competition, producing lower prices. All of those things would have happened. And the real bottom line here is any analyst, I believe, that's really looked at this believes if there is a government competitor, eventually the other competitors won't be able to continue in the business. And in fact, there's even language in the bill that says after the first 5 years, if your plan you have today hasn't complied with this new definition of what every plan has to look like, you have to go to the government plan. Or after the first 5 years, if you had been buying an individual policy, you have to go to the government plan. But most importantly, that government plan just simply, it doesn't pay taxes, it doesn't have to pay 100% of the health care costs.
Then let me ask you this,
and it would
Congressman.
eventually put everybody else out of business.
All right, I apologize, sir. We're running tight on time here, but
that's all right.
We know where Republicans kind of stand, almost in unison on this particular issue. The wild cards are going to be those blue dog Democrats, the 50, 52, however many there are. We know that Congressman Waxman was able to get 4 of them over to his point of view when it came to this cooperative to handle care. Where do they stand now? Do you suspect that the math will work out that the overwhelming majority of blue dogs will still go along with whatever the rest of the Democrats put out?
You know, my guess is that what happens is they get a bill out of committee today with the help of the blue dogs on the committee, and then people look at this House Energy Committee bill and the other bills as they come together on the House side for 6 weeks, and my guess is people are extremely concerned over August about what the specifics of this bill says, how it eliminates the likelihood that they'll be able to keep what they have now.
Right.
And I think members are going to come back here after Labor Day, and we're going to have to start all over again.
Congressman, always good having you. Thank you for joining us and
good to see you, Neil.
Indulging my goose analogies. You were great. Thank you very much. Well, is this the kind of news that kind of puts it